All right. So, hello everyone. Um, I want to welcome you all to Montefiore Community Chat webinar at Montefiore Nike Hospital. Today is August 25th, and I will be your host, filling in for Sandra Arevalo. My name is Enéa Soares, and I am a coordinator educator at Montefiore Nike Hospital. Today we have a great topic that we're going to be covering: breastfeeding, myths and truths around it. And to assist in clarifying those myths and truths, I'm happy to have with us today two experts, Fadila Sabayo and Paula Loeb. Please feel free to ask questions in the chat room or QA. And without further ado, let's go to our experts and get to know a little bit about them. So, Paula, could you please tell us a little bit about yourself and we start the meeting, please?
Yes, my name is Paula Loeb. I am a board certified lactation consultant since 2001. I have been working on the postpartum unit at Montefiore Nyack Hospital for, I think, 17 years now.
Wow.
Yeah, so it's a lot of babies when you add it up, about 1,200 per year. Most of our moms are initiating breastfeeding, and more are doing so exclusively. And we're really trying to help all mothers reach their own goals in terms of their parenting and infant feeding regarding breastfeeding. I have 3 adult sons of my own, and I just always enjoy continuing to work with moms and babies. It's very rewarding for me.
Fantastic. Fadila? We can't hear you. We can't hear you.
Breastfeeding month. Can you hear me okay?
Now we can hear you.
Beautiful. My name is Fadila Ceballos. I'm a registered dietitian and lactation consultant. I have been working with maternal and child health for the past 10 years. I started my career at WIC, and I did a lot of breastfeeding education and nutrition counseling at the WIC program. And slowly I gained a lot of experience in breastfeeding education, and I have since become a lactation counselor and an international board certified lactation consultant since 2019. I look forward to having as many years of experience as Paula has. And I help moms and parents with their breastfeeding journey on the pediatrics side. Once they come for their first pediatrics visit, I assess their breastfeeding and help them at the Bronx Health Collective. And so that's where my journey has taken me.
So we have a lot of experience there to be shared with our attendees. I look forward to the questions. So feel free to write the questions there in QA or in the chat room. So one of my own question is it true that women breastfeeding can prevent a pregnancy? Is that a myth, true or false? That's one curiosity of my own.
It is partially true. Don't mind me jumping in, Fidels, I'm sorry. The breastfeeding changed the hormonal state in the woman's body that is somewhat preventative for ovulation and menstruation. I believe you need to be exclusively breastfeeding, no pacifiers, and feeding around the clock on demand. And it is in the 90% protective for about the first 6 months if you meet all of those guidelines. That said, there are always those that do return to ovulation sooner. I wouldn't say it is 100% reliable, and that if you were trying to prevent another pregnancy so soon after having your own infant, you might want to supplement with another type of birth control.
Thank you, Paula. That explains why I have 5 more siblings. Probably mother didn't follow all the requirements there, I can tell you this. Okay. Another question, Fadila, do you have any input there, please?
Yeah, I would say anecdotally, you know, my grandma also used birth control as a form of birth control. And, you know, this was back when there was not a lot of choice in, especially in Nicaragua, where I'm from. So, you know, she would breastfeed for 3 years, and every 3 years she would have a baby, because once she stopped, she would have another baby. But there are so many factors, right? Like you said, Paula, like having an exclusively breastfeeding experience does help that number of birth control go up, but yeah, it's not the most reliable, I would say.
All right. Is it is only two questions that I have, a curiosity of my own. Men should not get involved in breastfeeding, but my thoughts are this. If breastfeeding is a bond with the baby and the mother, how does the father bond them if he does not have to get involved in that? Is it still, does it hold the truth that men should not get involved in them? Anybody has ever asked that question? It's just a question of my own, please. Mhm.
I would say that, you know, there are a lot of, you know, family misconceptions about what they can do. And everybody, whether it's a grandmother, you know, many years ago, I think my mother included, was very excited to be involved to feed the baby a bottle. And and the same for fathers wanting to be involved, of course, is fantastic. As far as the physical bonding and feeding, I think supporting their, you know, partners' efforts at breastfeeding as best they can. And there are a lot of other things that dads or grandmas or other partners can do to spend intimate time bonding with the baby. So one of the suggestions is bathing the baby.
Oh, interesting.
That dads can take over that job, and a lot of them will enjoy doing so, and good for snuggling and bonding. And, you know, doing a little skin to skin also. So skin to skin bonding with the infant is really the best way for moms, dads, and others to bond with the infant. So yes, of course they can be involved. Sometimes after breastfeeding is underway and moms are choosing to pump if they're returning to work, and dad wants to, if he's working, you know, to return to the family and maybe feed a bottle while mom can run out and run an errand. So, you know, in the very beginning, I think the support and the bonding and maybe taking over the infant bathing is helpful. Skin to skin is always calming and wonderful. But yeah, you know, with the advent and availability of expressed milk, certainly dad can feed the baby breast milk.
Thank you. I'll keep that in mind for future reference.
There you go.
Yeah, I mean, I would agree. I think everyone wants to feed the baby a bottle because it's such a fun experience, and it's such a wonderful, cozy way of spending time with an infant. But I think it's important to also be that supportive ally, right? Bring mom a snack, bring mom a water, a tea, you know, something to make them their experience better, you know, with breastfeeding. Take the baby after the feeding, put the baby down for her. You know, co-parents can be very, very involved in the breastfeeding experience. So I definitely encourage it. It's 2022. We need to, you know, break those what am I trying to say?
Like gender roles or
yes,
traditional roles of parenting.
Yes, we are adults, and it takes two to, you know, make a baby, so they have to be involved. I definitely
it comes to the truth that it takes a village to raise a child. It starts at home, right?
Yes.
Give support to the breastfeeding there, to the mothers.
I think it's also very helpful to involve other family members. A lot of concerns that I find that, you know, mothers are having are, you know, the older sibling who might be 2, 3, 5, 6, and with a mom with a new infant in her arms, it's difficult when one child is always used to having that lap to themselves. So I always tell them to try to include them in the experience. So you can put together a basket of snacks with a board book or, wherever your child is, a manipulative toy of some sort. And so that when they're feeling a little bit put off, as mom is spending a lot of time sitting down and feeding the baby, to ask the other child to go get their basket and sit with mom. So I read a lot of books. I had 3 boys and I had Matchbox cars running up and down my arm and a sleepy baby that they would tickle some feet or rub a leg, or, I think they learn nurturing behavior by sitting with mom during breastfeeding. It really kind of normalizes it for them from the beginning. And I think they learn nurturing behavior toward the infant as well.
The living proof to it. I had 5 other siblings. So have to learn how to share and how to
exactly
adapt to that situation.
Mm-hmm.
Okay. Those were my 2 questions. I thank you for answering it. So I'll let you to conduct with your own suggestion now. Free association. There are a few questions that I saw there that Sandra said, just see if it is a myth or not, if African-American women today don't need to breastfeed. So that was one of the questions. There are many others, but I'll let you to take it for now, both of you, and I'll keep on watching the Q&A and the chat room questions there. Is that okay?
Yes, it's great.
So take it away, please.
I can let you go on that one.
Go ahead, Fadila.
Sure. I think one of the first common questions that I have is my pregnant patients say, hey, I don't feel like I'm going to have milk. They're just very anxious about it. They're very nervous about doing it. And sometimes they have a lot of negative talk about breastfeeding for whatever reason, right? Sometimes in their baby showers, they don't have many gifts that are supportive of breastfeeding. They're getting gifted bottles. They're getting gifted other things that are related to formula feeding. And so when that confidence is down, sometimes, my pregnant patients are like, I don't think I'm gonna have enough milk. How do I know? And so this is a very common concern. I'm sure it's been happening for hundreds, if not thousands of years. But, formula has only been around for the past 100+ years, not very long, right? And so it's important to have that in mind when thinking about how our bodies work. Like if you are experiencing changes in your breast during the pregnancy, if you see that the breasts are feeling more tender, they might have grown during the pregnancy, you see that the areola is changing color, it's a little bit darker. All of these are changes that your body is doing to prepare you for breastfeeding. And so these are tips that I tell my patients because it kind of puts them at ease, like, oh, okay, my body is getting ready. And I think, it's hard to say, especially if it's a first-time parent, what will happen after. But I think it's important to kind of point those subtle changes and give them that confidence so that when they do give birth, they know that they can do it.
It seems that though it's generalized, each case is individual. It doesn't, all the rules doesn't apply to one. It seems like you have to tailor it to that mom and see what it works for her. Go ahead, Paula. Sorry.
Well, I think that, sometimes with the American Academy of Pediatrics makes the recommendation for exclusive breastfeeding for 6 months and continuing to breastfeed with supplemental foods introduced, for a year or beyond, as long as it is desired to continue. So I think for some people, it just seems like a very long horizon and commitment, and that they would feel like if I can't do that 100%, then maybe I shouldn't really get started or do it at all. And there are different complications, with moms' lives that can act as barriers to breastfeeding. Certainly, I think, in this day and age, most mothers are returning to work. And that is one of the biggest, concerns that they have. Well, I have to return to work in a few weeks or a few months, and, I'm just going to get started, and I'm probably going to have to give formula anyway. So some people are unaware, that breastfeeding and working are compatible with the Affordable Care Act. Many years ago now, it was seen as a matter of public health and preventative medicine that breast milk is the optimal food for all infants. So in different challenging, circumstances, also speaking to moms prenatally as they're making their decision, what are the concerns, family history, in the family, all the benefits of breastfeeding, just reviewing them, that, it can lower, an infant's risk of infections, including ear infections, which is one of the most common, reasons that new parents are seeing the pediatrician, for reducing, juvenile diabetes, obesity in children. I mean, these are all very important things that can set the stage for a lifetime of health. And I think having parents, as they're making that feeding decision, maybe consider those things and understand that there is support, after you have the baby, and there is support in terms of labor laws that allow breaks for pumping and so forth, that they may be able to get a pump for free from their insurance, which many people can now apply to get even prenatally. So knowing that that option is available may allow them to extend their breastfeeding for longer. And, we support exclusive breastfeeding and promote it, of course, but having to understand that that's not the choice that many women are going to want to do. And it's not an all or nothing. And I try to tell people, would they have these concerns about get started, what if it's short term? And I try to say that, some is better than none, and more is better than less. So I have to meet them where they are. And if it is not their goal to be exclusively breastfeeding, I can educate them about the benefits of doing so. But at the same time, I need to support their decision and help them meet their individual goals.
You mentioned several topics there that really, makes me think more about it. Is it a myth or the truth? And one of our attendees, while you're talking, Fadila, put a question there that some patients, they feel that their breastfeeding makes their breast long and might be hindering for them to do breastfeeding. True or false? Is that a myth, or is it truth that if you breastfeed, your breast gets long or sagging and all that? What is the truth behind that myth? And then we'll talk more about the formulas and other things that you mentioned.
Sure.
But just following up the question of one of our attendees, please.
Yes, go ahead.
I would say no one is immune to gravity. That's and aging. I think there are definitely some changes to the breast. You do have milk ducts that are continuously like filling and emptying, depending on how many pregnancies you have. But that does not necessarily mean that it's a negative thing, right? So some of the changes that are happening to the breast are also due to aging. So it's really, you can't really differentiate between those two, right? And so I ask, in return, like, do you care more about the look of the breast, or do you care more about the benefits of breastfeeding? Mm-hmm. We have to weigh those options, right? Because if I know I can feed my infant, for a long period of time, all the nutrients, all the benefits for them and for myself, I would much rather do that than worry about the look of my breasts.
Right.
So yeah.
And some women, come into, their parenting years, having had a prior breast surgery, right? So aesthetically, medically, breast reduction, or breast augmentation, does that preclude them from being able to breastfeed? For some, they just may not want to consider it. And then we get back to the question of, will the baby get enough? Will I make enough milk? And so we, will try to support moms and say, yes, a prior breast surgery can affect supply. And depending on how the surgery was done and so forth. But if they want to be breastfeeding, in all likelihood, they would be able to provide some milk. Would it be enough milk to breastfeed exclusively? We can't answer that question. So it would be different perhaps for every patient, but supporting them, to get started with early expression to stimulate the breast, either hand expression, pumping, combination, as well as trying to latch and feed the baby. I mean, for bonding purposes and a little bit of colostrum, if mom's able to make a full supply, maybe it's only for a short term in weeks or months. And as the baby's growing, the supply maybe doesn't keep up in those cases. But again, if it's their goal to put the baby to the breast, then by all means, we support that.
Perfect. One thing that you mentioned was reduction and augmentation.
Mhm.
Does that change the amount of milk produced? Does it dry up? That's one of the concerns that you mentioned,
Right.
that the women might not want to breastfeeding because they did the reduction or augmentation there aesthetically. How does
Right.
it affect the breastfeeding? Is it a myth that if you have it reduced, it will stop the production of milk to the baby and it will dry up? Any truth to that myth?
It can certainly reduce the milk supply, and the ongoing nature of maintaining the milk supply. So for some women, they're able to make some milk. I mean, a breast reduction, they're removing some functional breast tissue. They're not removing all functional breast tissue. They may have less. The way the surgery is done, if they've done around the areola, if they've moved the nipple, it may be more challenging because then there are stimulation aspects of nerves where it's a feedback system of supply and demand. So you may have an onset of a milk supply, but then for most mothers who are breastfeeding, the body is getting the signals and, hormonally, charging and balancing to bring in more milk. The breast is emptied and the body makes more. But there may be some mismessaging with nerve damage or modification that is done with some of the surgeries that may indeed affect the amount that could be made over time. But again, if mom is wanting to try it, it's not an all or nothing. It doesn't mean it has to be 100% of the baby's diet. We counsel them to get off to the best start they can, do some of this stimulation to try to boost the supply in addition to direct feeding, and doing everything you can to try to bring in your milk supply if that's what you want. You may be successful. You may have to change your definition of success as well. But again, bonding and support and some colostrum or milk is wonderful to provide.
Yep.
Go ahead, Fadil.
Just gonna say, it's important to take into consideration like how long ago the surgery was done, and if the person still has like nipple sensitivity and reaction, if the nipple reacts to touch, right? If it's all of that, but it's a very individualized case.
We are talking about surgery, reduction, and augmentation, but those who do not have either. So one of the myths is that mom might think that if the breasts are too small, then I cannot breastfeed, or if it is too large, I cannot breastfeed.
Right.
Just tell us what's the truth and the myth about that, please.
Yeah.
Go, you can take turns.
It's a good
We are
one,
in a
and it's
phase.
very common. It's a good question, and it's really, really common.
Yes. Don't be fooled. Don't be fooled by small breasts. It's all about the commitment to breastfeeding and about the stimulation and make frequency of emptying the breast. We do have to assess that there is enough breast tissue. There are some very few cases where the breast tissue might be malformed or it will not produce milk. But if the breast, again, if there are some breast changes during pregnancy, that's a really good sign that despite the size, they might be small, they can still make a full milk supply. I know that my friend recently had twins, and she has a full milk supply and she is very happy about it, but she worked really hard at it. So you want to make sure you're emptying the breast frequently. And if you do need to have more help in the first few weeks, I would also recommend trying to do triple feeding, which is, putting the infant on the breast, then pumping the breast, and then, if needed, supplementing a little bit, but making sure to get that stimulation and that empty breast often to signal to your body to make more milk.
Yeah, I think it's also useful to point out like all of the normal proactive things that you could be doing to make sure that you have the best supply. But just as a visual mindset, like there are really small women, petite women who have very large babies. They took care of themselves and proactively did everything that they could in their pregnancy to have the healthiest outcome as they could. And the baby may be large or small, but the body has worked beautifully in nearly all cases to make a healthy, perhaps large baby. There are some large and tall women who have very small babies. So, trust in your body is a bit of a leap for some people, and, letting them know, yes, absolutely. So I think that, a larger breast is comprised mostly of fat. And that the amount of functional tissue between a woman of a small or average or large size, may not have a vast difference in the amount of functional breast tissue. So starting to say, yes, let's try, and as Fadela was saying before, yes, there may be cases of hormonal insufficiency where mom did not have changes in the breast during pregnancy that don't support the growth of the early milk, or colostrum, to be made. But really, in most cases, most women are fully capable of making enough milk for their newborns.
You two touched two myths there. One was the demand and supply and the size of the baby. So there is always that concern for mothers that they are not going to have enough milk for the baby. But Fadila just said that her friend who had the twins, that is right there. So the demand and supply. I believe that the statistics says while you are breastfeeding your child regularly, your body is going to continue to produce that milk. So you don't have to be worried about going dry unless something else. And also the size of the baby. It doesn't mean that the baby is bigger. The baby is going to drink more or have more need for breastfeeding because the size of the stomach of the baby, the normal, they says the size of an almond. That's why you have to do regularly. So you talk about supply and demand and the size of the baby. Those were two myths there that people really get worried about, and you cover it beautifully.
I think also helping, parents understand that a small baby, a large baby, they're born infants with a limited stomach capacity. Right. So it's not that, the baby within a couple of pounds difference isn't going to make a stomach this big or this big, that it's still a small capacity. I think a lot of mothers also assume that they feel soft in the breast in the days after delivery, and they feel like I don't have enough because I can't feel it.
Mhm.
And even a second time mom, third time, remembers a breastfeeding experience where she had a large, heavy, full breast. And so going back to the beginning, needing to remind them that it takes your body a few days and regular feeding to get that to happen.
True.
And so I think just kind of reminding and educating them of that fact that, no, you don't have your full milk supply yet. In fact, your baby's not ready for it. Right. So newborn day 1, day 2 infant is not going to be ready for the ounces of milk that mom might be producing after a week. So they gradually grow together, and it should be enough to meet the baby's needs. I think also educating mothers, how do we know? Right. So your biggest concern as you're taking care of this baby human is to understand that, yes, the baby's getting enough, right? How is the frequency of feeding? We check the diapers. What goes in must come out, right? So, getting them, just explaining to them the expectations, normal feeding patterns, normal diapering patterns, and what's expected, right? We're not expecting 8 wet and dirty diapers on the first, second, or third day when they're in the hospital. So, and some mothers remember from their previous experience of changing diapers every couple of hours, and this baby seems dry, right? So, but looking to make sure that they're meeting the expectations for day 1 and day 2, the baby may have 1 or 2 wet and dirty diapers, and that's normal.
I'm glad to hear about the diapers that you have today. My time, my parents' time, it was not diapers, right? It was material. So we had the in the yard, the front yard, all those material diapers, hanging there. So you know how many it was. Now it is much simpler to see the amount on the diaper, and you can even weight that to make sure that what you do not see, what you feel, you can really check it. Well, there is enough weight on the diaper there that you know that your baby is getting enough breastfeeding there, enough nutrition, minerals, from the breastfeeding. Fadila?
Yeah, I would like to add that while Paula sees infants in the hospital, parents might not be getting the full milk supply there. But when they are in the pediatrics visit, where I see them sometimes, their breasts are just full. And they are so full that they can't get the milk out because they're so tender, and the infant has a hard time latching because they're bigger than they normally would be. So I think a lot of parents tend to expect that as like, I have a lot of milk, I have milk. But that's can be a sign of engorgement. It can be a sign of all the milk coming in at once. And if they don't have that in those first couple of days, they might feel like they're not producing anything. Meanwhile, they have colostrum, right? And so in the hospital, sometimes they might see, or in their previous pregnancies, they might have seen like a bottle of formula, and that's 2 ounces. So they expect an infant to require that much in the hospital. And so, if they're not getting anything out, or maybe a little bit of colostrum out, they compare and feel defeated. So I just want to point that out, because it's a very common misconception. And when they come to the pediatrics visit, they have sometimes already introduced formula without having that trust in their colostrum. So I just want to point that out and acknowledge that it is very predatory sometimes to like see that, right? And like Paula mentioned, once the milk supply is established, stable, the breasts are soft. They're soft. They can make milk on demand, right? And so some parents, I would say around the two month mark, are worried that they don't have milk anymore. And meanwhile, their baby is just gaining weight beautifully. So it's just another hurdle, I would say, to cross, to just make sure that you're trusting. If you've been breastfeeding regularly, exclusively, or even on a regular schedule, your body will adjust in those first few weeks, in that first like 4 to 6 weeks. And after that, you're pretty much set. Your baby is if your baby is latching well, they're getting their milk, and that milk supply has been established, and it's mature milk, and it changes. The volume might not change, but the composition changes as the baby grows, right? And so it might not seem like a lot of milk to you, but the baby is getting everything that they need from that breast milk.
And the supply does grow a little bit over time too with your growing baby, right? So like for your friend who had twins, brought in a big milk supply and kept it big. Whereas a lot of moms, we see in the early days at the hospital, will end up bringing in their milk and feeling somewhat engorged. Oh, is it always going to feel like this? No, your body figures it out. So the supply and demand is beautiful. For the mom of twins, she brings it in big and keeps it big. And for another mom, she may feel a little bit full as the body's trying to understand, are there two babies, one? Is the baby 10 pounds, 5 pounds, or somewhere in the middle? So the milk supply sort of corrects to how much the baby needs. So then after a couple of weeks, some mothers may feel that softening and assume that they don't have any more, but it's just because your body figured it out. So nature doesn't expect you to walk around so overfull and engorged. In fact, as you're making just what the baby needs, next month, the baby may be a little bigger and have a really hungry day, like a growth spurt where the baby seems like he wants to feed every hour. Again, preparing mothers ahead of time that you may encounter one of these days from time to time. And it's your body's like sort of auto correction of jumping it up. So the baby's 1 to 2 pounds bigger next month, and your milk supply is going to kind of correct a little bit to grow with the baby. So the on-demand feeding usually will help keep the milk supply in check and on track with the needs of the baby.
Thank you, Paula. There is a question there. Can the mom's diet and nutrition interferes with her production of milk? I'll add to that question from Denise, that both of you are talking about, the adaptation of the body to the milk supply. That the child also adapt to that when the pattern is established there. But what about those mothers that have more milk and they feel that the child now doesn't want to breastfeed, maybe because the taste of the breast milk is sour or went sour and all that. So I'm piggyback on the question of Denise that says, can the mom's diet and nutrition interferes with her production of milk? Go ahead, either of you, please.
I was going to say, I actually interpreted that question a little bit differently, because we do get a lot of questions, I'm sure Paula gets it too, about what to eat to make more milk. And so when I saw that question, I thought, the Denise was asking about like how nutrition affects the milk production. And what I like to point out is that the milk, if you establish a good milk supply, you're breastfeeding exclusively, the milk will be there. But if you're not eating well, where's the calcium going to come from? Whereas, that's going to come from your bones and your teeth. So you want to make sure you're eating well-balanced meals. You're eating to your hunger. You're drinking often. You're staying hydrated, because all these nutrients are going to come from you. And so you want to make sure that you're having well-balanced meals for your milk supply.
And letting people know who think that they have to have a very restrictive diet, eat this, don't eat that. I've heard this about, certain vegetables, versus eating everything they like. And I think that we try to, let moms know that they can return to whatever normal diet they typically enjoy. And yes, eat to meet your hunger. It takes some extra calories in the business of milk making in the body. So I can go out for a jog and try to burn a couple hundred calories and sweat myself in these hot summer months. And the manufacturing facility in the body is using a decent amount of calories just in the business of milk making. So, for some moms that are concerned about weight gain in the pregnancy and how am I going to lose weight, that trying to avoid, harsh diets that may be difficult to follow nutritionally is the body feeling sound nutritionally, but that, a harsh restrictive diet in terms of calories could affect the amount of milk that the mom is making. Also, as Fadila was saying, the quality, if you're not supplementing with a prenatal or multivitamin, that if you're missing some nutrient in your diet, your body will try to look and steal it from mom and put it in the milk for the baby. So a lot of times the milk is wonderfully, optimally nutritious, but mom's health and recovery can suffer at energy level. So yes, calories, hydration, and, honestly, weight loss, so, that's actually one of the benefits, to breastfeeding that, some people, are thinking about as well.
So it's a good point to say that breastfeeding is the way to go. And the statistics prove that. Now, there is another question there from one of our attendees. She said that she heard of this before, but never knew anyone personally that has done this. What? Can you breastfeed from each breast at the same time if you do have multiples? It reminds of your friend with twins there.
I think you can answer that because you helped your friend out a little bit with positioning on that.
So just think about
The
it.
answer is yes. Even if you do have one infant, what you might notice is that while you're breastfeeding on one breast, the other breast starts to leak. And sometimes infants, and as they grow a little bit older, kids start to play with the second breast to stimulate and get that milk down faster. And so you might see some leaking in the other breast, which, it's fine. It's just your body responding. And so you can definitely breastfeed on both breasts at the same time. What some people do also is to collect that extra milk that's leaking. They sometimes use like a silicone little pump to collect that milk, and so it doesn't go to waste.
Right. So the positioning with multiples at the same time can be a little tricky, but I know that they sell like the basic boppy pillow, which kind of goes around the body to help support the baby up to the height of the breast for breastfeeding. But there are also some that are kind of geared towards twins, like a twin pillow. And of course, filling in with regular household pillows is possible too, but getting one baby in position, say on a pillow on the side and under the arm and like a football clutch position, allowing one baby to start and having the other nearby, you may be able to, with a little bit of practice, get them both physically feeding at once. And so that can save mom some time. With multiples, if you knew that it was time for the babies to eat, maybe have a little bit, one is awake and one is not. I mean, certainly you could have a little bit of one-on-one, bonding with one of the infants. And then, as Fadela was saying too, if you're leaking a little bit, you could also maybe to the point where your others are helping you with the babies and your milk supply is good and you're using a pump, that you could feed one and sort of hold the pump on the other side. So yes, catching some of that milk and then, being able to give that to the other baby. Or managing sometimes for time management, and both babies are hungry right now, to be able, with a little bit of practice, to be able to position both at the breast at the same time. It's possible.
No, you touched on one point there, to breastfeed one child or multiples at the same time. One of the myths there that breastfeeding spoils the child. I'm very glad that I was very spoiled. So is this a myth or the truth? Does it spoil the child, breastfeeding?
I don't think feeding your baby and meeting your baby's needs for nutrition and love and bonding is in any way spoiling of the infant. I think it just really helps the baby to transition to life on the outside of mother. And they're not capable of manipulation at weeks, days, months of age. that they're expressing a need and you're answering it and giving them optimal nutrition. So I guess we should all be spoiled so well.
True.
That also builds trust, right? When you're responding to your infant's needs and cries, and that you want that trust to be, that bonding between
established. True. The other thing you spoke about, the size of the baby. It doesn't mean that if the baby is bigger, the baby is healthier. It's just the supply and demand there. I want to clarify that. And the other thing that I see as a myth, that the baby is crying a lot. And because of that, some parents, some mothers, they are concerned that the baby is not getting enough. And then they opt to supplement the feeding of the child. So if the baby cries a lot, is that a myth or truth or not, that you need to supplement the baby's feeding?
Well, I think that babies cry for different reasons. And a lot of times everybody thinks the answer is to just reach for more milk, which oftentimes the baby may not need. You know, a baby really can't overfeed at the breast. The baby's going to fall asleep or pull away if they're not interested in feeding. You know, babies do feed frequently. For the moms that we're dealing with in the immediate postpartum period, yes, when the baby's demonstrating those hunger cues, that little tiny tummy needs a little more. And it seems like a lot. I tell people it won't always look like this. But right now, your baby feeding frequently is going to help you bring in your milk supply. The baby is helping you. You're helping the baby transition and begin feedings and practice feedings and get little amounts of this colostrum and help you build your milk supply, right? So it's definitely, yes, they do feed frequently, cluster feeding. There's no rhyme or reason to it. It's hard to keep a newborn, you know, on a schedule. I mean, the baby's looking to eat. You meet the baby's needs by answering. But the cries could be a dirty diaper, not food, right?
True. Now, all these myths and all the benefits of breastfeeding, we still hear from different mothers. Breastfeeding is not for me. What are your thoughts about it?
I would inquire as to why. You know, there might be a lack of support around breastfeeding in the household or in the family. You know, back in the 70s, that's when the lowest breastfeeding rates were in the US. So a lot of our elders might not have been breastfed or did not see breastfeeding in their families. And so it might be foreign. For someone like me that grew up, you know, in Nicaragua, different country, Latin America is very open to breastfeeding. We don't bat an eye. And so people can breastfeed on the bus, like it doesn't matter. So it is important to kind of inquire as to why, and, you know, be respectful. Of course, it's their decision, but definitely get a sense of like what might be behind that, that answer.
Right, which with a little bit of education, maybe mom did have a prior breast surgery or thinks her breasts are too small, you know, where it just may be something that a little bit of guided education to address their concerns, you know, helps them, you know, understand. And maybe it is not for you, you know, is it a return to work issue? Is it a modesty issue,
Right.
You know, of exposing the breast? You know, is it that a partner might not be supportive? You know, sometimes there can be, you know, a history of trauma or abuse, you know, that may involve not wanting to have the breast exposed or touched. Right. So, you know, there can be a multitude of reasons, and with some sensitivity, I think that we can, you know, investigate and ask. And if it's something that is just an education issue that may help mom to make a different informed choice, you know, by all means, we do that. And I think that respectfully, to understand that it might not be for everyone, and the choice that I have made for my family or what one mom is making for her family may not be or work as the same choice for another.
I like what both of you said, explore the reasons behind it, but primarily respect that opinion at that moment for that mommy specifically. And there is a question there in the chat room. that I believe you just covered, Paula,
Mhm.
that she said, I went to an event and someone mentioned that the husband didn't want her to breastfeed. How do you handle a client with this issue? That's the question. So,
Well, I might
back to support.
investigate
Mhm.
again. I don't know that I'm speaking to the father directly, but I mean, kind of asking what is, the question or concern. Is it because mom is going to be out and about in the world and people might see her breast? Is it a sexuality, thing for dad, between the dad and the mother that is uncomfortable? Is it because he might feel the baby's going to take too much of mother's time? A lot of times I think pointing out the ease and convenience of it, in the familial household, when the baby's crying in the middle of the night, then this husband may be expected to get up and prepare a bottle and a feeding and, say, or you could just gently wake up your partner and say, I think the baby's hungry. And that might be easy. Also, speaking to the cost, right? I mean, now we're, dealing with and coming out of, I hope, the formula shortage, but the sheer cost of buying formula bottles and the like, I would say with older boys, that money would be better spent in a small college account than on formula.
Yes.
Don't get student loan, but if you do, you know that it can be below 10, you can get out of it, as we just said, the law was.
Yeah, right. But
No.
it's like $2,000 a year,
So
to be buying formula. And I don't think people realize the extent of that.
Right, and you just mentioned about the shortage. It feels like now you have to really get the formula, despite of all the benefits that we hear about breastfeeding and all the benefits of it to both the child, to the mother, and to the environment and economically. Now we are getting at the end of our webinar, so you have a few more minutes, and it's impossible to cover everything that I have to do about breastfeeding now. Any last thoughts? Any recommendation, any tips to the parents there? Paul and Fadila, go ahead.
I just want to acknowledge that there's a question in the Q&A.
Go ahead.
Heard women who had gestational diabetes ask if it is okay for them to breastfeed, and the answer is yes. Yes, they can breastfeed for sure. Breastfeeding is encouraged to every parent that can do it, and there are very, very few reasons to not breastfeed, one of them including HIV. But in this country, we definitely want to make sure that everyone is encouraged to breastfeed if they can.
Thank you for picking up on the question.
The immediate postpartum period, for the infant to sort of regulate their own blood glucose as well with a gestational diabetic or a diabetic mother, that typically the infant blood sugar is monitored. And the baby receiving mom's milk and sometimes skin to skin can help best to regulate the baby's heart rate, breathing, blood sugar. So it's actually a benefit that the baby be close skin to skin with mother and receive that early colostrum. We're encouraging moms to do a little hand expression, to give a little bit of the colostrum as well as direct feeding to the infant, to just give that extra step to help the baby regulate that sugar, that it really is helpful for the baby's transition.
Thank you. I appreciate the answer, picking up on that question, Fadila. We are almost at the end of our webinar, our chat, community chat. I want to thank you, everyone who attended it, and also to remind you that this has been recorded and it's going to be posted at Montefiore Hospital Community Health and Wellness. Click there, and also YouTube, community chat Montefiore. So without further ado, I just want to say that we're going to be ready for next week. Sandra will be back and she'll take over. But I'm very happy that I was here with you all and I had this opportunity to learn more about breastfeeding and the benefits and to clarify the myths and the truths about it. So without further ado, stay safe, have a great week. Until next time, okay?
Thank you so much.
Thanks for having me. Bye.
Take care, everyone. Bye-bye.